Hi everyone, welcome to week 7, Leadership, Culture, and Work Environments. So this week we explore organizational culture and the influence on the change process. We investigate how quality of work environments or work environment issues relate to practice settings, and we will suggest ways that leaders and nurses can work together to improve the quality of work life. So let's start off by looking at this theme of organizational culture. A major factor in the success of an organization is its culture. And we can think of organization as a hospital setting, a public health unit, maybe an individual nursing unit. So organizational culture can significantly influence the performance and the effectiveness of the organization, the morale and productivity of its employees, so say nurses, and the ability to attract, motivate, and retain talented people. Unfortunately, many leaders are unaware of the significant impact culture can have. Or they maybe are aware, but overwhelmed by the extensive and sometimes conflicting information available on culture, or are not well informed about how to build and sustain cultures effectively. Because of this, the close relationship between leading and managing an organization or a healthcare unit or a nursing unit well and achieving a winning culture escapes many leaders. So some really great organizations, let's say, for example, Apple, is the belief that if you get the culture right, most of the other stuff, like great customer service, and in our organizations, we would think of great patient care or great nursing leaders or great frontline nurses. So if we get the culture right, the other things will just fall into place. And so it's really important that if the culture is right, then you'll have great patient outcomes, and building a great long-term culture makes individuals passionate and customers or clients will be happy, and it will naturally happen on its own if you get the culture right. So when we think of organizational culture, it's the environment in which people work and the influence it has on how they think, act, and experience work. Culture can have a significant influence on performance, morale, job satisfaction, employee engagement and loyalty, employee attitudes and motivation, turnover, commitment to the organization or commitment to the nursing unit, and efforts to attract and retain talented employees. So what becomes evident in studying the themes of organizational culture is that to a large degree, healthy cultures are the result of effective leadership and management, whereas unhealthy cultures are the result of ineffective leadership and management. So let's watch this quick video on the Netflix culture around freedom and responsibility.
The biggest reason why freedom and responsibility drives the success of Netflix is it encourages us all to be big risk takers. So what does freedom and responsibility mean to me? It means three things. One, there's trust. I'm being trusted to make the right decisions in the best interest of Netflix. Number two is self-discipline. I have the self-discipline to exercise good due diligence and good judgment. And the third thing is accountability. I'm accountable for the outcomes of my decision, whether they're good or bad.
Freedom and responsibility to me is the gateway to creativity. When you have someone telling you what you can do and not what you can't do, to me, that's a very liberating framework in which to function.
What I like the most about freedom and responsibility is I think it speaks to the intelligence of people. You're trusting people by default. You step in a company, you're new, we're asking you to be thoughtful, to find the context, but actually we're giving you responsibilities, we're giving you the trust.
I think for me, I try to separate the two. I have the freedom to make the best decisions for the business, for my life, and responsibility is for me to make sure that the freedom in those decisions creates a positive impact for the business, for myself, for my family. That's how I look at it.
Freedom and responsibility means having the autonomy to make my own choices. It doesn't mean that I can do whatever I want.
It is freedom to make the right decisions for the business. It's not freedom to do what
I want to do in any given moment. For me, it felt like I was being employed by somebody who recognized I was a sensible grown-up.
In many cases, we mistake having the freedom to take decisions with not having to listen to others. I think freedom and responsibility speaks about the trust that is deposited in you to make that call at the end of the day, but it should be a consequence of all those conversations we've had with your peers, not taking decisions by yourself and not considering the context and the people around you.
At any other company, you constantly have all this red tape and all these people you have to get through, but having a manager that leads by example, that constantly explains it, that points out examples of how someone's really doing it well, I think is what I've always appreciated.
The one piece of advice that I would give to a new person at Netflix is to be confident that you are the person who knows what is best for Netflix in your business and in your market.
You were hired here as an expert, and reminding you of that and knowing that you have that in you is just a matter of like taking that step back and allowing you that freedom then to do it on your own. You definitely do that. You're so great. You're great.
Ask yourself, have I tried something different today? If it's uncomfortable, seek advice from peers. Have them help you vet it.
Be vulnerable and accept that we all make mistakes. Nobody comes here knowing everything, and there is no magic wand. We all take our time to understand and digest information, and this is totally fine.
To those people struggling with it, I say embrace it because it's really empowering. And those people who latch onto it as a buzzword and think it's really simple, just stop, take a moment, think about how deep it is. Think about the nuances of these words and think about what it really means.
You already possess these qualities anyway, and I feel that intuitively, freedom and responsibility are traits that are inherent to us on an everyday basis.
So that's just one example of the Netflix culture, which bases their culture on freedom and responsibility. So now let's look at what or how nurses describe what it means to work in a magnet hospital, the culture there.
I would say in honor of teamwork, patient-centered superior care, excellence in nursing, compassion, hardworking,
unique, special,
quality, dedication, quality, highest quality that can be given.
Prestige. I think of teamwork, excellence.
I think of excellence.
Excellent care, and we're recognized for that.
I think of empowerment,
attraction,
passion, value, respect, collaboration,
love. Because love is just, that's what we do here. We love our kids, and that's the kind of care that we give, is a loving care.
It's rewarding. It's fun. Makes me think that we have a high standard in nursing, and that we give great care, and I'm proud to be a part of that. People come from all over to come here. I know plenty of nurses who do not work here who would love to work here.
I think if a hospital is a magnet hospital, I immediately think it's one of the best hospitals, and I think Children's being a magnet hospital means it's one of the best there is in the country.
The hospitals that are magnet are by far just reaching out and changing their course so much differently than the ones that aren't. The nurses have a voice, there's a professionalism.
I think it provides more opportunities for growth. It provides me more opportunities in using the latest research and technologies, kind of the best care out there.
To be certified in your specialty is very important, I think, and it also shows that you care about what you're doing and you want to give good care.
It really means that we work together as a team, and us as nurses are heard and we are respected.
We have dedicated nurses that are truly excellent in what we do and give it their all.
Because we do a lot of evidence-based stuff, a lot of investigating. We're always doing different studies and research projects, and we use that information to better our practice. So I feel like when you work here, you can really stand behind what you do in your job and for the kids.
We do work very closely with all the nurses here, the techs, the physician, the anesthesiologist. So they take what you say. They believe that you are also looking out for the rest of the patient.
We have a team-focused care system. Everyone kind of voices from their standpoint, and then nursing, I feel like we kind of tie it all together and we give the overall view of the patient.
We as nurses work closely with the physicians, we work closely with respiratory therapists, and we have a voice in making the plan that directly impacts the patient care, and I think that's a very special quality of this hospital itself. We're very heavily involved in rounds, and they do listen to what our ideas are, especially because we spend so much time at the bedside.
We are directly involved in shaping the way that care is provided here at Children's Hospital. You get to hear from nurses throughout all different units, through different scopes of practice, and all of our input is what comes back to the patient care.
Every day families hug us on their way out. The smiles, the kids, the doctors, my coworkers, just everything about it is wonderful.
Words can't describe. I feel like I really made a difference. I left my house for work in the morning and I go back to my house knowing that I really made a difference in someone's life. I love working here.
The smiles that I get from the children saying that I've done something just to make them feel a little bit better.
That aha moment where, okay, I can see how if we do this, it is going to help.
People listen, oh, that's a good idea, let's try that. So much is changing in healthcare right now. It's just like the best time to be in nursing. And nursing has established our credibility as professionals. We have a lot of autonomy. We can impact lives at a rate and a depth that wasn't possible years ago.
You believe in what you're doing and you can tell the peers you are in the best place you possibly can be.
I would honestly say that it is one of the best. I feel like we have the top standards and we can provide the best quality of care. Every day I'm excited to come to work. I know that I'm working with peers that are excited to be here. They're here for the kids and the families and everybody working together for the common goal of getting the kids home.
So I want you to think about the culture in that organization. So this is what we're talking about organizational culture, building a culture where people want to work there. You have the greatest patient outcomes. There's empowerment of nurses. And so that's the basis of what this lecture is about, is building that type of organizational culture. So the next part we're going to look at is some insights about culture which nurses need to be aware of. So leaders influence the culture through their strategies, through their practices and values, their style and examples. And the impact of leaders on culture is particularly influential at the top level. So it needs to be a top-down approach. It needs to come from high up, and you need to model that culture all the way down. And role modeling is as a leader, you role model the desired behaviors that you want to see. And when you think about the influences of leaders in shaping culture, the strategy and the culture are important leadership priorities. Now, it's also important to understand the dominant cultures and the subcultures and to develop a clear understanding of those cultures, because there's always a little bit of the percolating of the subcultures that may not be similar to what you're seeing or what you want to see as the dominant culture. And so when using the term organization to describe the whole of an institution or the whole of a hospital or a public healthcare unit, it's important to recognize that while organizations are likely to have an overriding dominant culture that defines them, they are also likely to have a number of subcultures in various parts of the organization that stray away from the dominant culture. And so that's important as your job to pull those subcultures back into the dominant culture. So when we think about change in an organization, we know it can be difficult and challenging. And changing the organization's culture is also very challenging. And culture is very pervasive. It's largely hidden and therefore sometimes difficult to change. And people don't change their values readily. And so there's visible and invisible factors that define culture. So culture can be defined on two levels. There's a visible level that can be observed by such things as the way people dress, the layout of the hospital, the design of the hospital, the emphasis on technology, patient care. And so these artifacts, such as what I just said, dress, layout, design, could also include leadership style, the nature of the work environment, how people are treated, and how decisions are made and get implemented. Is it a shared decision making? There's also that invisible level characterized by people's expressed values, the underlying assumptions and deep beliefs. And expressed values are consciously held convictions. So clearly stated or practiced, they influence the behavior of group members. And so all the invisible cultural elements that you don't see. So the invisible is characterized by your values, your underlying assumptions, and your deep beliefs. Express values, examples of express values are, for me, it's important to take great care of the children in our hospital. And so this attitude will create a different culture than that of an organization with the dominant value saying about we really need to cut costs because maximizing our bottom line is all about cutting costs. No matter what it takes to get there, we need to cut costs. Well, that underlying kind of culture is not going to bring about great patient outcomes. So you need to identify, communicate, educate, and engage nurses in the cultural ideals of what you want to build. So to build a strong culture purposely, the desired cultural values need to be identified and made known. So again, organizations need to develop what their cultural values are. And then you have if that's true, you'll have that value congruence of what you saw in the magnet hospitals, that the individual nurses' values are in congruence, or they align with the values of the organization. So that's really important, that an individual's or personal values and the organizational culture are the same. Leaders need to know that the past and present history of the groups that they lead. So it's really important to have some type of insight into the traditions and the dynamics that should be maybe sustained if you're a new leader coming in, or those that need to be changed. And so, traditions are the practices that have become common to a group over a period of time. And so a group, for example, may have a history of great teamwork, great involvement in the decision-making process. They may be high-level performers, and they're a strong group through loyalty. On the other hand, a group might have a history of minimal teamwork, leader-driven decision-making with little team involvement, and satisfaction with good but not great performance. And so it's really important for leaders to have an understanding of the traditions and the group dynamics that they're walking into. So there are a number of internal and external circumstances that can affect culture. So internal circumstances could include such things as the organizational structures. So we talked about that in last class, the organization empowerment structures, the systems, the budgets, the leadership styles, as well as changes in leadership team members, as well as these internal circumstances. There's also external circumstances, which could include such things as, what's happening economically. COVID is hitting. It's had a big economic strain on a lot of people, including healthcare. Are there new government regulations coming down? Or maybe the hospital is going through a major lawsuit that could damage the reputation of the hospital. Maybe there's an unexpected catastrophe. So it's really good to understand the internal and the external circumstances that influence culture. As well, the types of behaviors that are valued and devalued influence the shaping of an organizational culture. So people respond to behaviors, good or bad, that are valued and rewarded, while they avoid behaviors that are not valued or rewarded or are devalued. And so understanding this makes it important for leaders to really put across the desired behaviors and the behaviors they are actually motivating in the people that they work with. And so for some leaders, a careful examination of the reward system may reveal that rewarded behaviors encourage self-serving actions and discourage teamwork, or that going the extra mile goes unnoticed or unrewarded. So it's important to look at what type of values are important to move forward to develop that important culture. And then don't forget about influential members. So one or more influential group members can have a significant positive or negative influence on the culture. Remember, it only takes one. And so there are group members who bring out the best in others and contribute to a positive work environment, and those who impact groups in negative ways. And so understanding the impact that influential people can have on culture is essential, and is essential in order for leaders to cautiously choose the appropriate individuals who fit with the desired culture and to manage behaviors that threaten the culture of groups. So that's really important when you're hiring certain individuals. And then strong cultures and weak cultures. So three things happen when an organization has a strong culture. First thing is employees know how top management wants them to respond to any situation, so it's a top-down approach. Employees believe that the expected response is the proper one, and employees know that they will be rewarded for demonstrating the organizational values. So the term strong culture describes cultures that have a significant influence on the behaviors and practices of employees or nurses. So in strong cultures, there's a clear understanding of what the cultural values and norms are. The term weak culture is used to describe cultures where the norms and practices are not well known or are confusing, inconsistent, or not reinforced. And so weak cultures are difficult to work in because expectations are unclear and there is little consistency in practices throughout the organization. Whereas strong cultures are generally associated with much higher performance than weak cultures. And so, such things as certain symbols, certain ceremonies, socialization, and stories are all terms to communicate the idea that leaders should look for opportunities to reinforce the desired culture. Other ideas are to appoint a culture team to ensure that the unit stays on track or the organization stays on track with the appropriate or the valued culture. And then lastly, it's important to understand international cultural differences. And so within the existence of organizations, so many leaders involved in organizations need to take into account, especially with nurses in our internationally educated nursing program, is that we need to take into account international cultural differences. And it's really important for the success of organizational culture. And so imposing one's own cultural values and practices may not be successful in cultures that have a strong history of doing things differently. So that's important to understand. So what leaders need to know about cultural organizational culture. So this is where I want to leave off. So it's important for you to know that culture matters and that building and managing culture is an important role of leaders. Culture is built by design, not by default. It's not just going to happen. And think about hiring for culture. So think about it. Have you influenced the culture within an organization? Have you worked within an organization that has a strong culture versus a weak culture? And just think about what you liked about that strong cultural organization versus the weak culture. So moving on, let's look at organizational commitment. So organizational commitment and staff satisfaction. So as you can see from the video on the magnet hospitals, staff who are satisfied with their tasks, their work environments, and the way they are treated by their organizations are likely to feel a deeper connection to their organizations and increase their organizational commitment. When nurses perceive that their organization aligns with their values, they come to believe that they are members of the organization and are more likely to feel personally connected to the organization. Low levels of job satisfaction and organizational commitment are associated with negative work outcomes. For example, missed nursing care, poor quality nursing care, decreased organizational cultural behavior, and high turnover. And so that's related to low levels of job satisfaction and they're linked to organizational commitment. So let's think about work environment issues. So supportive work environments refer to organizational characteristics that facilitate nurses to provide good professional practice. Again, a magnet hospital. Organizational characteristics may include adequate staffing, flexible scheduling, supportive leadership and career advancement opportunities. Supportive nursing work environments result in positive nursing outcomes and enables nurses to utilize their knowledge and expertise to provide high quality patient care. That's what you want within an organization, to have a supportive work environment. But what about the impact of poor work environment issues in nursing practice settings? So it can lead to interpersonal conflict, poor work environment, inadequate staffing, limited resources, lack of support, but more specific things such as a high nurse turnover, inadequate patient care, job dissatisfaction, job strain, increased illness rates among nurses, maybe some poor decision making, patient safety could be an issue. Maybe there's minimal time to build interprofessional relationships, stress, and burnout. So let's talk about burnout. So burnout occurs when physical and mental collapse emerge and the effects of stress can no longer be managed. And it has a direct effect on important outcomes related to nurse retention, including job satisfaction, organizational commitment, and turnover. So if we look at the examples of factors that contribute to burnout, bullying, moral distress, so that's where your values don't align, workload issues, poor support systems, and nurse burnout can contribute to resignation, poor patient satisfaction scores, and higher infection rates in patients. So these are just some of the patient outcomes that happen from burnout. So we're going to watch this video on the 8 signs of nursing burnout. So this is from the allnurses.com in 2019. So some good things to consider when you're thinking about a burnout. And so, there is evidence which has indicated that nurses are more likely to be satisfied with their jobs and less likely to experience burnout if they feel that they fit into the organization. So we're again back to organizational commitment and organizational culture. And so I want to talk a little bit about the person environment fit theory. And so the person environment fit theory is just that, is that there is that connection between the person and their values and the environment, the organizational culture and the organization commitment. So there is that theory that that's what you need. So let's talk about stress. So work environment issues also lead to stress. And stress and leadership issues induce job dissatisfaction and turnover for nurses. Stress also results in increased rates of job strain and illness rates among nurses. Also, nurses exposed to prolonged stress experience anxiety, depression, sleep deprivation, compassion fatigue, nurse turnover, depersonalization and burnout. And we can only imagine what we're going to see with our colleagues at the bedside struggling through the COVID-19 pandemic. And so, leaders need to invest in strategies to increase resiliency in order to maintain a healthy workforce. So resilience is the ability to overcome stress by using external and internal coping strategies. Nurses may face one or more factors that contribute to burnout in the work environment, and how nurses handle them is based on their resilience. So coping strategies are determined by nurses' level of resiliency, and these are vital for nurses to use in overcoming a stressful environment. Having a sense of hope and meaning and external coping strategies will increase resiliency and decrease burnout. As value congruence is a valuable job resource that strengthens nurses' resilience. So having that good organizational culture that aligns with a nurse's values. So personality traits correlated with increased resiliency in nurses are here. Individuals who are optimistic, self-efficacy, critical thinking, ability to reset, to have a pause and just reset, creative thinking, problem solving, and being flexible. And so I'm asking, can you think of any resilient strategies that work for you or that you can develop? Some of the strategies to increase resiliency are mindfulness-based stress reduction training workshops, one-on-one discussions, improving your communication skills, writing exercises, so journaling. Emotional distancing can be very important, conflict training, having social events outside the work environment. Event trigger exercises. So what are some things that trigger you in your workday? And then breaks from stressful situations. And I mean, this is all complex. So it's a bunch of complexity. So all these factors influence each other and contribute to your quality of work life. And as a manager and a leader, these are the things that you need to consider or to think about when you're improving the work life for the nurses that you work with. So culture, work environment, value congruence, and organizational commitment. And so the quality of work life. So it's defined as the level to which people who are working in the organization yield both personal and work satisfaction by achieving the goals of the organization. And so you're getting, it's love what you do and do what you love. And that's where you want to get to as a nurse manager or a leader, is to ensure that the people that work in your unit are feeling that they're both getting personal and work satisfaction from working on the unit. And employee contentment is vital, as individuals will feel comfortable where they are recognized, acknowledged, required, and respected. So it's very important to build that contentment through empowerment strategies. So, think about it. What are the ways in which nurses and leaders can work together? Well, nurses and employers need to collaborate to create and maintain practice environments that support effective and shared decision making at the point of care, and also contribute to a high sense of which will also contribute to a high sense of job fulfillment and autonomy for nurses. Organizations need to focus on the work environment, particularly at the unit level, to reduce workplace turnover and improve job satisfaction. Management should focus on creating work conditions that prevent workplace incivility and subsequent burnout to ensure both employee and organizational health. So that's really important. They're zero tolerance policies. And then staff need to build relationships to support each other. So that's really important. So in what ways will you work with other leaders and nurses to improve your quality of work life? So just be cognizant of what you can do to improve your quality of work life and how you can work with other leaders or your manager. So coming up next will be liberating structures, and it's just a process or a strategy that can be used by nurse leaders to develop some shared decision making with your staff. That's up next.